This is Dr. Jane West, and I'm going to be talking about male breast disease. Before we start looking at the images, we're first going to talk a little bit about male breast development. So the breast tissue is identical in males and females from birth up to puberty. During puberty in males, there is an increase in testosterone to estrogen ratio. This results in temporary proliferation of breast ducts and stroma, followed by involution of the ducts. The terminal lobular units do not develop in male breasts due to the absence of progesterone. So as an adult, there is a rudimentary structure of subcutaneous adipose tissue, remnant ductal tissue, small nipple areolar complex, and a prominent pectoralis muscle. Here is an example of what a normal male breast looks like. We see here that we have a prominent pectoralis muscle. We really don't have much for breast tissue. You'll usually see just a small amount of tissue right behind the nipple. Our first case here is a male presenting with a palpable lump within the left breast. And we first look at the mammogram. This is the craniocaudal view, and this is the right breast, which is normal. And here is the left breast. We see a triangle marker indicating the palpable lump in the subareolar region. Corresponding to that palpable lump is an irregular high-density mass. So this patient will go to ultrasound. The ultrasound image, this is the skin, this is the breast tissue, pectoralis muscle, and here's that palpable lump with a corresponding irregular hypoechoic mass. This was biopsied and was found to represent a breast cancer. Overall, breast cancer in males are rare and accounts for less than 1% of all breast cancers. The risk factors are genetic factors, most notably BRCA, hormonal imbalances, and history of chest radiation, such as from lymphoma treatment. In a male, cancer diagnosis is often delayed due to its rarity, with over 40% of cancers diagnosed at stage 3 or 4. The median age is 63 to 71. And a lot of times with women, we'll see calcifications with the breast cancer. In men, we don't. And that's usually due to the females. It's related to the involuted ductal structures in the males. Here's another example of a case. This is a male presenting with a palpable lump indicated by this triangle marker. On the craniocaudal mammogram in the subareolar right breast, we see a high-density mass. This patient went to ultrasound. And again, this is the skin, breast tissue, and then the chest wall. Here's an irregular hypoechoic mass corresponding to that palpable lump. This mass looks a little bit more circumscribed than the other one, but you can see here the borders are lobulated. This did proceed to biopsy, and this was a breast cancer as well. This is a case of a patient presenting with a palpable lump in the subareolar right breast. Again, we can see the triangle marker. This is a great case where we can tell this is a male because there's large pectoralis muscles bilaterally. We can see in the subareolar breast, there are bilateral subareolar densities which look symmetric. They have a flamed shape appearance. And on the mammogram, this is a very characteristic appearance of gynecomastia. There's no mass-like qualities to it. There's no discrete mass, no calcification seen. This is gynecomastia, and no further imaging workup is needed. Clinical recommendation is recommended for any clinical change. Gynecomastia is increase in breast size due to proliferation of the breast ducts and stromal tissue. It's secondary to increased estrogen to testosterone ratio. As I said, it presents usually as a flame-shaped density on the mammogram and is very, very common. It was found that 55% of males at autopsy had some sort of degree of gynecomastia. It is the most common cause of a palpable mass in men. Overall, mammography is the preferred imaging to evaluate this as it does have a characteristic appearance. It is very common for this to occur on one side and not the other. That would be asymmetric gynecomastia. It is typically seen in peripubertal boys and men older than 50, and there's a lot of etiologies of it. It can be due to obesity, Klinefelter syndrome, systemic diseases such as cirrhosis, renal failure. It can be neoplastic or related to medications, and they usually follow up with their primary clinician for further evaluation. This is a patient that presented with a palpable lump in the subareolar right breast. We have the craniocaudal and the MLO mammograms. Again, a triangle marker indicates this is a palpable lump. And we can see in the right breast there is a density which is flamed shape but demonstrates no mass-like or concerning characteristics. This is consistent with gynecomastia, which is asymmetric from the left side but is benign. This is a different case. This is a patient that presented under the age of 25. This patient was actually in their teenage years, but if they're 25 and under, we do start imaging evaluation with an ultrasound rather than a mammogram due to that age. Here we can see this is the skin, this is the subcutaneous or breast tissue, and this is the pectoralis muscle. There is a mixed echogenic area in the subareolar region corresponding to the palpable lump. We always get an image of the contralateral or asymmetric breast for comparison, and we see a much smaller but similar appearance on this side. This, if you could think about how it would correlate to a mammogram, would correlate to a flame-shaped area as well. This is very consistent with gynecomastia in an adolescent male, and it is benign. Here is a case of a patient who is presenting with another palpable lump. On the mammogram, the triangle marker indicates the palpable lump. There is a corresponding high-density mass. On the mammogram, it does appear oval. We did an ultrasound which confirms there is a circumscribed oval mass corresponding to that palpable lump. If I was looking at this on a female, this really does look like a fibroadenoma. However, that would not be a normal structure in a male, and that goes back to our first slide where we talked about male breast development, and men do not develop their lobular units, so we would never see something like a cyst or a fibroadenoma in a male. So based on that, we know this is concerning and biopsy is warranted. This came back as a myofibroblastoma. It is the only breast tumor that occurs more commonly in males than females, particularly in elderly males. It is a benign spindle cell tumor and is seen as a circumscribed mass without calcifications, and again has a similar appearance to a fibroadenoma. Complete resection of this is recommended given the high rate of recurrence if incomplete margins.